brings people from different backgrounds. All of the groups that will perform on November 23rd are all from the community. We'll have a Latino group, traditional African Americans, people from all different backgrounds, but they reflect the population we serve. So the community knows about this event, but everything that we do is centered around looking at that whole person, mind, body, and spirit.
So, you know, one of the things when I talk about forward thinking on your part and on the part of your team is when you are building, when you're constructing this facility, you also constructed it with, built it with a lot of open space, knowing that at some point you were going to have to fill that space. And recently we've had one of the other community health centers shut its doors, and those folks, those patients, and those resources had to go somewhere else. Did some of that come your way? And was that part of the thinking, not that one would close, but if in fact something like that happened, you would be prepared for it?
When we look at the racial and ethnic disparities in healthcare, clearly significant numbers of our community are still not connected to healthcare. So it would have not been strategic of me to build a facility that I hope to last my lifetime and my children's lifetime, and to just build it based on the needs. So I built it based on unmet needs, based on growth. If you look at Roxbury, for example, there's still a lot, when we host events, there's still people coming to us that have not been to a healthcare provider in decades. So I built it with the knowing the needs of the community, and that's why we perform a community needs assessment every year, but also looking at the growth, looking at what people call the Obamacare healthcare reform, looking at the changing demographics, looking at baby boomers. I mean, just looking at strategically. So for example, last year we provided 105 clinic visits at the clinic. The building is built for up to 220,000 visits. So it's built for growth, but also it's open and airy, as you said. It's a welcoming place. It's all glass, where we wanted to make it such that when people come in there, they feel a sense of peace. They feel a sense of respect and dignity. And so when the opportunity came to take over the WorksComp patients, we applied to the federal government, the Health Resources Services Association, and we were lucky. We were the fortunate organization. We put in all our efforts.
Fortunate, not lucky.
We were lucky.
You were ready
but
for
what
it,
we did, though, once WorksComp closed its door February 19th, we were open and ready. So we worked with the receiver, Attorney Feaster. We worked with the WorksComp board to help with the transition, because I was not as focused on the grant as I was focusing on our commitment to the community. These are Roxbury community residents, North Dorchester community residents that needed a new medical home. So their phones were connected to our phones. We assigned 5 case managers to help them. We provided transportation. And so when the opportunity came to apply for the grant on May 15th, we were ready. And the federal government knew we were ready. So we applied, and we were the successful recipients of $9.5 million over 5 years. And what that supports is the hiring of 51 new staff people. Many of them will be psychiatrists. Dental is a major issue in our community. Primary care providers, but also a lot of case managers and frontline staff, and all these will be community residents. So these are 51 new jobs.
So you say you had 105,000 patient visits last year, which seems to me to be a lot more than maybe some of the smaller hospitals. Talk to me about partnerships that you have with other hospitals or bigger hospitals.
Well, we have a relationship with, for example, we're the first community health center that has a cancer care center at our community health center. So you do know we have a Dana-Farber Community Cancer Center at Whittier Street Health Center. It's on the 5th floor. And there we have medical oncologists from Dana-Farber and the Brigham and Women's Hospital that come to us. And what it does, it makes it easier. It makes the connection. So it's about early detection, screening, and getting people into care. So they build the relationship with the Dana-Farber team at Whittier. And then if they're diagnosed with cancer, they are navigated by a nurse care manager that's based at Whittier when they're referred over to Dana-Farber and to the Brigham and Women's Hospital. Last year, there were 155 people with cancer diagnosed at Whittier Street Health Center. by the Dana-Farber cancer team. And those are people, if we were to refer them to the hospital, they would have been lost in the system. We also have relationship with a lot of the other community health centers, and we work with Boston Medical Center. So what we do is, we know we can't be all things to all people. I've recently, with my team, launched this 5-year strategic plan that we're calling the Boston Health Equity Project, where we've identified specific community outcomes, outcomes for our patient population, and clinical outcomes that we hope to accomplish between now and 2017 to see how we are making a contribution towards addressing the racial and ethnic disparities. We have a bold mission that says that our focus is on wellness and prevention and to eliminate health and social disparities. To eliminate something that's such a major issue requires a lot of work. So that's why we're very serious about our focus.
You know, the descriptive bowl is you. I mean, that was a very good word to use, because I've known you for quite some time, and you are not only forward-thinking, but you are bold. You are not afraid of tackling the big challenges. It's not just the kind of surface-level challenges, it's the big challenges. Talk to me how you work with the city and the state. Do you have relationships with the city and state?
Oh,
Talk
I
to me
do.
about
I have
that.
a good relationship. I also have to say that we have a wonderful team at Whittier. A leader is only as good as their team. And so as bold as I am, I'm also a good talent scout, where I have, because working with someone like me that's always looking for creative ways, you have to have a dedicated team to put up with me.
Yeah, I work
and
with
I
you.
do.
I know.
I'm blessed to have that. And we have wonderful relationships with the state. Mayor Menino has been a wonderful supporter of Whittier Street Health Center. We're watching the next mayor, we're watching the campaign and who becomes a new mayor, and hope that we have the same relationship. Also, as a city resident, I live in Boston. I have a vested interest, and we work closely with the Boston Public Health Commission. Matter of fact, they produce a report called the Health of Boston that shows you the health of all the different neighborhoods, and that's what we use to measure. So right now we're serving 25,000 people. By 2017, I hope to get to 40,000. So we know what the measures are around hypertension, cardiovascular disease, diabetes, and so we're measuring ourselves around that. We work closely with the Department of Public Health around public health issues. So we have wonderful city and state relationships that support our mission. We're also the WIC site for Roxbury. So we have a site at Whittier, we have a site at Dimmock, and we had a site at Roxcomb, but since Roxcomb closed, we just opened one on Warren Street where the Higher Ground has their office.
Oh, yeah.
So, and to meet the needs of the community, we will start providing free shuttle services. Transportation is a major barrier to people getting into the care. If you live in Mattapan, it could take you 2 hours on different buses just to get to us. And so that could be a barrier for people.
How do you do outreach for, or do you do any outreach to bring in more? How do you do? What do you do?
So,
I've seen the commercials with your son.
Thank you.
Those are these are good.
Things, So in addition to the 105,000 visits, we provide another 20,000 community outreach visits. And so, for example, let's take the implementation of the Affordable Care Act. We have financial counselors that work with our community outreach team that go out in the community with our laptops so we can help people with the application process. We've also been certified so we can help people when they go to the health exchange to look for insurance. As a federally funded health center, we don't deny care to anyone regardless of their ability to pay for services. We're very active in the 5 public. We're the only federally funded public housing primary care provider, which means the federal government provides funding for us to be based in this public housing and provide services. And we could take our outreach team to Logan. We have a men's team that does outreach with the taxi drivers at Logan Airport. We have relationship with schools. Madison Park, we're part of the Circle of Promise, working with the city of Boston. We're the medical home of the Higgins in Lewis School. So we work with different relationships, and at different community health centers, we have a lot of faith-based relationships with the mosque and with a lot of churches. Right. And we have a team, our community relations team. The way we built the building at Whittier, everything on the second floor relates to the community. We have a very large community education room, right. So we could bring someone from Dana-Farber to teach a class at Whittier, nice. Or we could bring the class to a community setting.
Nice. So you're situated in a predominantly neighborhoods of color, yeah. But that demographic is beginning to change. Yeah, yeah. Are you ready for the changing demographics? Yes. and probably the coming affluence of what's going to make itself evident in the next 3 to 5 years in that area?
And that's why, for me, my focus was ensuring that gentrification had hit Roxbury when I started on this path in 2002, right. And we wanted to make sure that we had a permanent stake in the community. We will not lose sight of our mission to address racial and ethnic disparities. We will not lose sight of our focus on vulnerable population, minority population, low income, but also we're diversified such that we can serve all people. 18% of our patients right now are privately insured. Okay. And we also, with our large eye care department where we sell glasses, we have optometrists and ophthalmologists, dental practice. We also have things that we can sell. We have entrepreneurial businesses that helps to support our mission. We have the large pharmacy here, there where some of the medications are subsidized by the federal government, so if someone can't pay for their prescription, as long as you're a Whittier patient, you get your medication free of charge.
Well, with this holistic approach to health and welfare, do you also have something for youth, for kids?
Oh, absolutely.
Aside from just looking at their health, but something where the kids can come.
We have after-school programs.
Right.
Matter of fact, we just had a big back-to-school event where there were 800 children we gave backpacks to and gym bags. We have after-school programs around childhood obesity. One we have is called Race Around Roxbury. With all of the housing developments that we worked with, we hosted a summer camp. There were about 85 students in the summer camp. Nice. The youth, and we have a youth development team, and they host HIV workshops, poetry reading, arts therapy. So we have a lot of youth activities, and we also have a computer lab for the youth to use when they're doing their homework with their youth mentors. So the focus on youth development is a priority because they are our future. And we need to get them into healthy from a whole life point of view.
So we've got a new mayor coming online this year. We've got a new governor coming online next year. I don't know. Am I talking to the future Secretary of Health and
No, you're not. I have no political aspirations. I will tell you, no one should worry about me. I am a missionary, mission-focused, and I'm an entrepreneur, and I love my job. I see myself retiring at Whittier. End of story.
So we've only got about a minute or so left. If folks want to get in touch with your organization, how do they get more information? The website, telephone?
They can call out main number 617-427-1000. We just revamped our website, WS as in street, H as in health, C as in center.org. So WSHC.org, wealth of information. Another thing that we're launching is a new patient portal where patients will be able to communicate directly with their physicians, have access to their medical records, have access to their labs, be able to schedule appointments, because everyone has an iPhone these days or some, Android that can connect you to the internet. So that patient web portal will be launched in October. But the website and the main number are the two sources of communications to Whittier.
As always, it's been a pleasure sitting here and chatting with you about what you do and what you're doing. I mean, when you talk about being a missionary, you truly are a missionary for health and welfare. And we really appreciate you being here.
And we appreciate you too. You're a missionary in what you do, and we hold you in high regard and very thrilled with the work that you're doing. And thank you for the partnership with the House of Corrections.
Thank you so much. So listen, folks, Frederica Williams, CEO, Whittier Health Center, Health Clinic, Whittier Street Health Center, my bad, I'm sorry. Look, we're out of time, we're out of here. We'll be back again next week. Until then, you take care of yourself. Peace.